When a person's skin is broken and bleeding, she has an open wound. Most open wounds will stop bleeding on their own after a few minutes. In cases of severe bleeding, have someone call 911 or the local emergency number immediately. Check the scene for safety. Obtain consent to give care. Check the person. Follow standard precautions, including gloves and other personal protective equipment when providing care. Cover the wound with a sterile dressing or clean cloth. Apply pressure on the wound until the bleeding stops. Wrap a roller bandage around the dressing to secure it in place and keep pressure on the wound. Start from the end farthest from the heart. Overlap the roller bandage several times to completely cover the dressing. Tape or tie off the end of the bandage to keep it in place and keep pressure on the wound. If bleeding does not stop, do not remove the blood-soaked bandages and dressings. Apply additional dressings and bandages and continue to apply pressure. Do not attempt to wash or clean a severely bleeding wound. Your first priority is to control the bleeding. Take steps to minimize shock and call 911 or the local emergency number if you haven't already done so. In cases where an object is embedded or impaled in a person's skin, caring for the wound is slightly different. Do not remove the object. Removing it may cause more damage. Keep the object and the body part still. Place gauze dressings around the object. Lightly press the area around the wound, but do not press on or move the object. Surround the object with bulky dressings to keep it from moving. Carefully wrap a roller bandage over the dressings and around the object, but do not cover the object itself. Overlap the bandage until the dressings and object are completely secure, then tie or tape the bandage in place. Monitor the person's condition until a trained responder or EMS personnel take over. If bleeding continues, apply more bandages and maintain pressure.